everyone, welcome to today, where I wanted to talk to you about urinary tract infections. So a urinary tract infection is an infection of the urinary tract, obviously, and the urinary tract consists of the kidneys, the ureters, which are basically part of your upper urinary tract. The ureters connect the kidneys to the bladder, and then your bladder and your urethra is basically the lower urinary tract, and your urethra is a tube that basically connects your bladder to the outside. So pretty much a urinary tract infection is one of the most common infections, with bladder infections being the most common overall, with about over half of all women experiencing a bladder infection of some sort at least once in their life. Now, UTIs have different names according to where the infection is. So you have cystitis, which is an inflammation of the bladder, urethritis, which is an inflammation of the urethra, which, as I said, is the tube from your bladder to the front of your vagina, which is where the urine leaves the body. And then sometimes it's called pyelonephritis or nephritis, which is inflammation of the kidneys. You'll hear sometimes doctors talk about a simple UTI, which is an infection in one place. So that might just be purely an infection of the bladder, or a complicated UTI, which is where you have infections in lots of areas. So it might be you have the cystitis and urethritis or nephritis. So it's in lots of different parts, the kidneys, the bladder, urethra, ureter, they're all kind of infected. Or you have other risk factors such as being immunocompromised. Now, there are some risk factors for getting a UTI, being pregnant, perimenopause, postmenopause. In fact, actually being a woman in general is a risk factor for getting a UTI because we have a shorter urethra than men, which means you're much more likely to get bacteria moving up and in. Anyone who's immunocompromised, so that can be specific health conditions such as autoimmune disease and diabetes, cancer. People who have catheters in, the elderly, anyone who isn't really practicing good hygiene, and we'll talk about that later on in the tips. Any kind of imbalance of bacteria in your gut or your vagina can actually also cause infections in the urinary tract because the bacteria migrate. And a family history, particularly mothers and sisters as well, and like really close family members. The main cause of a urinary tract infection is from bacteria, and in particular a bacteria called Escherichia coli or E. coli. And it's believed to cause up to 95% of infections. Other bacteria that may be causative include Staphylococcus, Saprophyticus, Proteus species, Klebsiella species, and Enterococcus species. Occasionally, but rarely, UTIs can be caused by Candida. So because of that, pretty much the main treatment for a UTI will be antibiotics and possibly even painkillers. Typical symptoms can be that burning, horrible pain or discomfort when you actually urinate, frequent urination, and urgency to urinate, pain in the pubic area or low abdominal region, pain in the lower back. If you have pain in the lower back, that's more indicative of a kidney infection. Any smelly or cloudy or a change in your normal color of your urine, it's possibly not due to a bacterial infection. If that does happen, it's more likely to be due to dehydration or diet. Sometimes that can also be indicative of kidney stones if you have the pain too. But keeping an eye on your urine is really important, and anything that's a little bit different from normal is worth getting checked. Now, you must go to a doctor if you experience any of the following. So one, if you're pregnant and you're experiencing those UTI symptoms, if you have a diagnosed health condition that affects immunity, such as diabetes or cancer or autoimmune disease, and you have those UTI symptoms, get checked. If you're elderly and you are experiencing a UTI, go and get checked. If you have a fever, so it's anything over 38 degrees Celsius, severe pain or an increasing pain, it's not getting any better, particularly if it is in that lower back, and you're having urinary tract type symptoms, infection symptoms, any blood in the urine, any confusion or delirium alongside everything else, increased heart rate and palpitations, nausea and vomiting, your breathing rate increases, all of those along with those UTI type symptoms, go and see a doctor and get checked. If you have more than 3 UTIs in 12 months or more than 2 in 6 months, again, you need to go to the GP and just get checked to make sure, to see what's going on. And they'll usually do a urine dip test to have a look and see what your urine's like and if there's any blood or white blood cells or nitrates in your urine. So general tips to reduce UTIs occurring, and there's a lot that you can do. So the first thing is to drink enough water, because dehydration is one of the leading causes of UTIs. The general recommendation is 2.5 litres of water per day to prevent a UTI occurring in the first place. Wiping from front to back after urinating, or you have a bowel motion, and that's to stop the bacteria or basically your poo going into your urethra and causing an infection. Treating constipation. So constipation can actually put pressure on the bladder, can even obstruct the bladder from actually allowing urine to pass into the urethra and out, and that can lead to infection. So it's really important that you address constipation and get support. So making sure you're eating the fiber-rich foods, plant foods, is really important. You can try having 2 kiwi fruit in the evening before you go to bed. There's something called PHGG, partially hydrolyzed guar gum, which is excellent for constipation. Trying psyllium husk is really good, the Metamucil, but make sure you drink a lot of water alongside it. Go and get some help to treat that constipation if this is chronic constipation, because you're going to put yourself at risk of a UTI on top of the constipation, and you need to find out what's going on and why you're constipated. Treating diarrhea as well, or loose bowel motions, is really important, because that can also increase your risk of dehydration, and also that fecal contamination, so poo going into the urethra. It's really important to find out the cause of the diarrhea, so you don't necessarily want to be taking something like Imodium to kind of hold it all in. You really want to find out if it's due to an infection or food intolerance and deal with that, but if you've got chronic diarrhea, you need to get that assessed. In general, eating prebiotic, fiber-rich and probiotic foods can also help to reduce any kind of imbalance or dysbiosis in the gut, which can play a role in those UTIs. So basically means eating lots of plants. So the ideal is 9 to 10 plants a day, whatever that looks like. That includes legumes and grains, as well as your veggies and your fruit. Sometimes that's not easy, so start small, work your way up and get support if you find that you're not tolerating plants, because that again can easily be addressed with support. But you really want to get prebiotic and fiber rich foods in your diet to create a healthy balance of gut bacteria, which will then prevent a UTI from coming about, and also prevent that constipation and possibly even diarrhea. Reducing alcohol and those refined sugar-rich carbohydrates is also really important, because that will also prevent dysbiosis from happening, and it will also prevent dehydration, and can also reduce that inflammation too. The next thing is to consider changing your contraception. So there's been some evidence to show that some contraception can actually increase your risk. So the spermicide in condoms can actually increase your risk by it basically changes the pH in the vagina, and changes the vaginal microbiome, which then your vagina's right next to your urethra, can actually then affect the pH in the urethra. Diaphragms also can increase your risk, and IUCD such as the Mirena can also increase your risk of UTIs. So don't forget the gut, the vagina, the urinary tract, they're all closely linked and all right next door to each other. So when one is out of balance, it can really affect the others. The next thing is to avoid tight-fitting clothing and non-natural breathable fabrics. Make sure your knickers are cotton, for example. Occasionally, I'd say walk around commando style. Get some fresh air circulating around your nether regions is really, really important. It's also tempting to hold in the wee, but don't, because it's going to make it worse. If you need to urinate, then go and urinate. Holding it in increases your risk. And don't stop drinking water because you don't want to urinate, because that will increase your risk too. It's a vicious cycle, because you don't want to be, you're going to worry about drinking water because that means you're going to wee lots. But actually, if you don't do that, you're going to increase your risk, and then you'll be having that frequent, urgent feeling of needing to go to the toilet because you've got a UTI. So please don't hold in. Go when you need to go and drink water. Also have showers instead of baths, particularly if you find that you're commonly getting those recurrent urinary tract infections. Then have showers, don't have baths. And it's really important that you don't overwash your nether regions either. Douching can make it worse, whether it's a vaginal infection or a urinary tract infection. Always wash your hands after touching down there. I know if I'm talking to a woman, I'm talking to the converted, but it still needs to be said. And the next thing is, too much sex can increase the risk. So sorry, any men listening, but it's true, and you're welcome, ladies. Other treatments. So lowered estrogen can increase the risk for recurrent UTIs. So if you're perimenopausal or postmenopausal, then your risk increases. If you find that you are, again, having those recurrent infections, then it might be worth considering a topical vaginal estrogen cream. There's some really good studies to show it can be really effective at reducing the risk. More than oral estrogen, that doesn't show any benefit at all. And vaginal estrogen cream actually has relatively low health risks. So if you're having recurrent chronic urinary tract infections, then go and speak to your GP, because it might be that a vaginal estrogen cream can actually make a big difference. Cranberry juice or capsules may reduce the risk, although the studies are really inconclusive and there's a lot of contradictory studies. It looks like powders and capsules are more effective than juice. Some juice have lots of sugar in, and that actually exacerbates and increases the risk. There are some studies that showed that cranberry can actually reduce the risk by 47%, but the concentration of cranberry has to be really high. So more than 18% of whatever it is you're taking has to be cranberry. At the moment, a therapeutic dose hasn't really been found yet, and the studies aren't great, so that we do need better studies. Taking cranberry capsules at night has been shown to be possibly more effective, and it's really important to know if you are taking warfarin, then don't use cranberry, because the two interact. Now, the next thing is, which I would say is probably a little bit more promising in regards to research, is D-mannose. So that's a compound that's found to stop bacteria, particularly E. coli, from actually adhering to the wall, setting up home and causing an infection. So there was a recent meta-analysis, which is considered to be the best form of study, which is when they look at lots and lots of studies, and they basically put the studies together and, using software, come up with a conclusion based on what all of the studies found. And in 2020, this meta-analysis found that D-mannose to be as effective as antibiotics at preventing infection. So not treating infection, preventing it. So some people, if they're getting chronic recurrent infections, are sometimes put on very low dose antibiotics as a preventative. So D-mannose was found to be just as effective, and thereby probably safer, because it's not going to disrupt the gut bacteria. So it's been found to be really effective. So the study concluded that the most effective and the safest dose, because at really high doses, some people were getting diarrhea and an upset gut. They found that the best dose was 0.15 grams per kilogram of body weight. So in a woman of 77.4 kilograms, the daily dose is around 11.5 grams of D-mannose, which is actually the higher dose than found in a lot of studies that said that D-mannose was ineffective. When they actually looked at the studies with a much higher dose, that higher dose was found to be effective. But you also want it to be not too high that it then causes side effects, if that makes sense. So D-mannose is a really good evidence-based preventative for chronic UTIs. Probiotics might also be useful as a preventative measure rather than necessarily a treatment. Studies, again, there are some studies that are inconclusive and contradictory, but there are studies that show that lactobacillus species, so they make lactic acid, They are specifically beneficial for UTIs. One of the things that they do is that they can make something called hydrogen peroxide, which actually changes the pH. And in doing that, basically makes the environment not a pleasant one for E. coli, which is really, really helpful. So lactobacillus rhamnosus is one of the most studied. There are a few others. So it reduces the pH of urine. It outcompetes E. coli for both space and food. It takes up residence, and therefore E. coli can't survive. So the current recommendations are for what's called 10 to the power of 8 colony forming units per capsule. So you need to have a look at that. 10 billion colony forming units per capsule. It also appears that taking intravaginally rather than orally made the difference. That actually decreased the risk by 12%. So at the moment, particularly in New Zealand, there's no specific vaginal probiotics recommended. But keep your eye out, because I suspect we'll start seeing some soon. The next thing I wanted to talk about was irritable bladder. So irritable bladder is different from a urinary tract infection, but it can come about as a result of a urinary tract infection. So it's basically when the function of the bladder doesn't work properly, and it can cause really similar symptoms to a urinary tract infection. It's usually caused by some kind of trauma to the pelvic region or the abdomen. Birth is a really common cause of irritable bladder. Chronic infections, nerve damage, medications and certain fluids can also create irritable bladder. Now, if you've been diagnosed with this condition, then you might find it beneficial to reduce things like coffee, tea, carbonated drinks, alcohol, spicy foods, acidic fruits like citrus, tomatoes, and fruit juices, just because they can actually exacerbate the symptoms. There's been a study to show that vitamin C and calcium supplementation can actually help to reduce symptoms. And there's also been quite a few studies to show that electrical stimulation and hypnotherapy can be beneficial alongside pelvic floor exercises given by a qualified women's health physio, can be really, really helpful. So the next thing I want to talk about is the woo-woo. It's the woo-woo hippie shit, as my son likes to call it. So I've had UTIs twice in my life. The first time I was a very young adult and I was having lots of fun. So I don't need to discuss that any further, because I'm pretty sure you can work out what that meant. And the second time was when I was actually nominated for an award that I really, really wanted. This is a long time ago. I didn't get the award. I was absolutely gutted, and I got a UTI that day. And then it went away a day or two afterwards. I remember thinking that was weird. And then it came back the day of the award ceremony, and I realised it was because I was pissed off. And I can't tell you how many times I've seen this in my clinical practice too, where when I've said to someone, when did your UTI come about? Doesn't necessarily mean this is the same for everybody. But I'll say, when did the UTI come about? And there's usually a situation or a row or something that happened around that time. So I'm really open to the idea that our emotions can sometimes cause physical symptoms. Now, Louise Hay, an amazing, amazing woman, in her book, You Can Heal Your Life, suggests that UTIs can be caused by being pissed off, especially in relationships, or from blaming others. And she provides a beautiful affirmation in her book to change your thoughts. She says, I release the pattern in my consciousness that created this condition, and I am willing to change. I love and approve of myself. Such a cool affirmation. So take time out to reflect. If you are someone that gets a urinary tract infection, have a look. It might not necessarily a chronic one, but if you have a UTI, just think about what happened 24 hours beforehand, or just a day or two beforehand. And were you pissed off about something? Take time to reflect to see if the thought that it could be because you were pissed off, whether that resonates with you. And then make an agreement with yourself to let it go. Forgive the situation and move on. You might think it's nuts, but it's free and it only has positive side effects. So consider that if it seems to be a one-off UTI. I hope this is beneficial. I hope you've got some tips here. I hope there's some food for thought. Please remember to reach out to me. You can email me at admin@sarah-brenchley.com. Let me know your thoughts, or if you've got any questions. And go to my website, sarah-brenchley.com, if you want to make an appointment to talk to me about this, if it's something that you experience. And if you go to my website, look at my blog, you'll find there's about 16 references from the studies that I mentioned as well. You can go and have a look at those if you actually want to read some of those, the research papers too. So thank you for giving up your time to listen to me. Have a fantastic day, and I will see you soon.